The misconceptions regarding the Bible that we inherit from others can be so heavily ingrained in church culture that we sometimes fail to question them. For example, how many wise men visited Jesus when he was born? I'll give you a moment to think about it. The answer most commonly given is 3. This answer, however, is incorrect. The only gospel to mention the wise men is Matthew, and Matthew gives no particular number. So why does 3 seem like the right answer? Most likely because Matthew records 3 distinct gifts offered by the wise men: gifts of gold, frankincense, and myrrh. So, let me ask you another question. How did Jesus really die? You'd be right to answer crucifixion, but crucifixion was only the instrument or manner of Christ's death. What was the actual cause? To answer this, we'll take a deep dive into the historical context of the crucifixion through the eyes of a medical doctor. This is a medical examination of the cross. To start, it's important that we understand some of the historical context. This video won't address the events or reasons leading up to Christ's trial, conviction, and crucifixion, but we will take a closer look at the historical practice of Roman scourging and crucifixion. Matthew 27:26 reads, "Having scourged Jesus, Pilate delivered him to be crucified." Crucifixion was prefaced by scourging, either on the way to the cross or before the victim began the trip to the cross. Tied to a post, the condemned person would be beaten with the flagellum, a leather whip with metal knotted into its thongs. This whipping bloodied the victim's back, leaving strips of flesh hanging from the wounds. In ecclesiastical history, Eusebius writes, "Bystanders were struck with amazement when they saw them lacerated with scourges even to the innermost veins and arteries, so that the hidden inward parts of the body, both their bowels and their members, were exposed to view." After the grisly scourging, Christ would have had his arms outstretched and tied to a plank of wood called the patibulum. Having stretched out both of his arms and fastened them to a piece of wood which extended across his breasts and shoulders as far as his wrists. The patibulum had an estimated weight of 60 pounds, 27 kilograms, and would become the horizontal piece of the cross. After fixing Christ's arms to the patibulum, he was led up to the place of his crucifixion, Golgotha, Aramaic for the place of the skull, or in Latin, Calvary. The criminal was then thrown to the ground on his back, with his arms outstretched along the patibulum. His hands could be nailed or tied to the crossbar, but nailing, apparently, was preferred by the Romans. The archaeological remains of a crucified body, found in an ossuary near Jerusalem and dating from the time of Christ, indicate that the nails were tapered iron spikes approximately 5 to 7 inches, 13 to 18 centimeters long, with a square shaft of 3/8 inch, 1 centimeter across. The nails commonly were driven through the wrists rather than the palms. A nail through the mid-palm could potentially be unstable and pull through the flesh between the fingers from the force of the victim's body weight, but a nail placed through the wrist bones, carpal bones, or above the wrist would be stable and hold the victim on the cross. After being fixed to the patibulum, Jesus would have been hoisted onto the vertical part of the cross, also known as the stripes. This is where another common misconception occurs, namely the shape of the cross. While most depictions of the cross are a lowercase t shape, also known as a crux immissa, it is far more likely that the cross of Christ was an uppercase T shape, also known as a crux commissa. Crucifixion was a frequent practice that made the more complex structure of the cross imissa impractical for routine use. Many extra-biblical sources also suggest the uppercase T-shaped cross being the standard for crucifixion. Besides an impractical structure, there was also a problem with the weight of the crux imissa. On average, a fully assembled crux imissa was 300 pounds, 136 kilograms. The idea that prisoners condemned to crucifixion would be expected to carry a cross of this weight seems highly unlikely. With reasonable certainty, Jesus was crucified on a crux commissa, a T-shaped cross, having a height of 6 to 8 feet. Jesus would have been eye to eye with his executioners while hanging on the cross. The long vertical piece of the cross, the stripes, was permanently fixed to the ground. Soldiers lifted the patibulum with the attached victim up onto the stripes. The patibulum was held in place on top of the stripes by a mortise and tenon joint. The feet were then nailed to the stripes. Nails piercing the top of Jesus' feet may also be an artistic invention. Archaeological evidence suggests it may actually have been common practice to hammer a nail through the heel. To prolong the crucifixion process, a horizontal wooden block or plank serving as a crude seat, sedile or sedulum, often was attached midway down the stripes. Only very rarely, and probably later than the time of Christ, was an additional block, supedenium, employed for transfixion of the feet. For 6 hours, Jesus hung on the cross. It was often customary for Roman soldiers to break the legs of those crucified to hasten their death, but when they arrived to find Jesus, he was already dead. Since it was the day of preparation, and so that the bodies would not remain on the cross on the Sabbath, for the Sabbath was a high day, the Jews asked Pilate that their legs might be broken and that they might be taken away. So the soldiers came and broke the legs of the first and of the other who had been crucified with him. But when they came to Jesus and saw that he was already dead, they did not break his legs. But one of the soldiers pierced his side with a spear, and at once there came out blood and water. There was no doubt that Jesus was dead. Roman military was well known for their violence and expertise in execution. It was often the case that if a condemned prisoner escaped, or if a soldier failed to perform his duty of execution, that the soldier himself would take the place of the prisoner, giving great incentive to ensure the death of those condemned. This is evidenced in Acts 16:21. When the jailer woke and saw that the prison doors were open, he drew his sword and was about to kill himself, supposing that the prisoners had escaped. Since the exact moment of death by crucifixion was uncertain, executioners could ensure death by a spear thrust into the victim's side, such as was dealt to Jesus. The extent of Jesus' tortures was such that he could never have survived the crucifixion and entombment. Clearly, the weight of historical and medical evidence indicates that Jesus was dead before the wound to his side was inflicted, and supports the traditional view that the spear, thrust between his right ribs, probably perforated not only the right lung, but also the pericardium and heart, and thereby ensured his death. Accordingly, interpretations based on the assumption that Jesus did not die on the cross appear to be at odds with modern medical knowledge. With the historical context in view, we can now move on to the medical commentary on details regarding the sweating of blood, fluid deprivation, the severity of Jesus' beatings, the effects of scourging, lung injury, signs of shock, the water and blood from the spear thrust, and the actual cause of Christ's death. The night before the crucifixion, Jesus and the disciples ascended the Mount of Olives, and Jesus prayed fervently to the Father about what was about to take place. And being in agony, he prayed more earnestly, and his sweat became like great drops of blood falling down to the ground. Sweating blood, called hematidrosis in medical terminology, is a rarely observed phenomenon. It is the spontaneous discharge of blood through the skin, sweating blood. The rarest form of hematidrosis is single-episode psychogenic hematidrosis and is associated with the fear of death prior to execution. There are only a handful of reported cases of this kind. That Jesus sweat blood indicates he had clear understanding of the horror he was about to experience. It is interesting that only Luke, a physician, wrote about Jesus sweating blood. He must have considered it a significant detail. During times of emotional distress, sweating is increased due to the increased elevated circulating catecholamines, hormones made by the adrenal gland, in the blood. This is caused by sympathetic nervous system activation and commonly called a fight or flight response or an adrenaline rush. A high state of anxiety and sweating would contribute to dehydration. Jesus would have been without food or water for at least 12 hours prior to being placed on the cross. We can safely assume that Jesus would have been deprived of anything to eat or drink after his arrest. Symptoms of dehydration could include thirst, dry mouth, headache, dizziness, confusion, muscle cramps, and heart palpitations. Roman scourging caused blunt trauma, contusions, and lacerations all over the body. This would have caused significant blood loss from the cuts and tears in the flesh, as well as bruising from blunt trauma. Scourging and blunt trauma to the chest wall can cause injury to the lungs. In traumatic hemorrhagic shock, seemingly the case with Jesus, shock occurs from decreased circulating blood volume due to injury and bleeding. Symptoms can include confusion, lightheadedness, feeling cold or clammy, weakness, and extreme thirst. The spear would have entered Jesus' chest wall between the ribs. Pleural effusion, fluid around the lung, generally has a clear appearance and would be described as water by someone in the ancient world. When the spear ruptured the heart, blood would mix with the fluid in the chest and give the appearance of blood emanating from the chest wound. As mentioned earlier, crucifixion was only the instrument or manner of death. What was the actual cause? Could it be cardiac rupture, the spear thrust to the chest, suffocation, or was it something else entirely? Let's take a closer look at some of the most popular theories, started with what is certainly the most poetic, namely, a broken heart. Interestingly, in more recent times, it has been found that severe emotional distress can affect the heart muscle. There is a rare condition called Takotsubo, stress-induced cardiomyopathy, sometimes called the broken heart syndrome. This condition occurs after extreme stress. It temporarily weakens the heart muscle and actually causes the heart to balloon or dilate. When this occurs, the heart is unable to beat properly and causes symptoms indistinguishable from a heart attack. However, Jesus does not fit the profile of patients suffering from this syndrome. Only 3% of those affected by Takotsubo stress-induced cardiomyopathy are under age 50, and cardiac rupture is thought to occur in less than 2% of these patients. Patients are typically over age 50, 90% are female, and those affected generally have a good prognosis for recovery in the absence of any underlying cardiac disease. The most common cause of cardiac rupture is a heart attack. In medical terms, myocardial infarction. Heart attacks occur when a clot, thrombosis, occurs in an artery providing blood to a portion of the heart muscle. A heart attack would be very unlikely in a healthy male in his early 30s. Is it possible that Jesus survived up until the last moment when a Roman soldier thrust a spear into his side? Was this wound the final blow that caused Christ's death? Some have thought that the description of blood flowing from Jesus' side indicate that he was alive at that moment, the premise being that blood does not flow from a wound in a dead body. The idea that blood cannot flow from a corpse is not necessarily true, however. A large clot, such as could develop in the heart at the moment of death, may be unstable and reliquefy. Additionally, the effects of traumatic shock can impair the blood's usual clotting capacities, with a mandate that those being being executed had to die before sundown, soldiers broke the legs of the others being crucified. They would not have hesitated to break Jesus' legs also. Roman soldiers were skilled in execution and assuring condemned prisoners were killed. We must therefore conclude that Jesus was unmistakably dead, but to assure absolute certainty, a spear was thrust into his chest wall, which collapsed his lung and ruptured his heart. Perhaps the most ubiquitous theory is that of asphyxiation, or suffocation. Many popular-level apologetics books take this to be the case. Once a person is hanging in the vertical position, crucifixion is essentially an agonizingly slow death by asphyxiation. The nature of crucifixion virtually guarantees death from asphyxiation. While this theory is widely supported among experts, is there really enough evidence to back it up? Suffocation is the interruption of the breathing apparatus. Asphyxiation is the term given to the effects of oxygen deprivation, which potentially can lead to death. Suffocation can cause asphyxiation. Anbindung was a type of suspension torture used during the Austro-Hungarian War, where victims were suspended with their arms tied overhead with their feet unsupported. With the force of their entire body weight being supported only by arms tied directly overhead, the victims' chest walls were expanded, restricting the ribs from moving normally. Regular breathing became impossible, and victims rapidly developed severe pain and muscle spasms. There are logical problems with suffocation being the mechanism of Jesus' death, however. Anbindung torture differs from crucifixion in that the arms were tied directly overhead and the feet were left dangling unsupported. In crucifixion, the arms were restrained to the side rather than directly overhead, and legs were supported by being nailed in place. Crucifixion could last for days, suggesting that breathing while on the cross was not restricted in any significant way. Jesus himself spoke with the others being crucified with him. It is counterintuitive to think that crucifixion victims could carry on a conversation if they were suffocating. Conversing during prolonged Anbindung suspension torture would be impossible. Dr. Frederick Zugibe performed an interesting reenactment experiment, placing subjects on a cross while monitoring their vital signs and blood chemistry. All subjects maintained normal arterial pH and oxygenation throughout the experiment. Subjects fastened to the cross only by their arms with their feet dangling unsupported had severe arm pain, but their breathing was unaffected. It is almost certain that crucifixion victims were not able to pull themselves up with their arms. The primary muscles flexing the arms are the biceps brachii. With the body leaning forward and the arms outstretched on the cross, the biceps muscles would be elongated and at a mechanical disadvantage. In a stretched or elongated position, the biceps muscles would also have diminished contractile capability. The notion that crucifixion victims had to push and pull themselves up on the cross to keep from suffocating finds little empiric support. Theories like cardiac rupture, a fatal spear thrust, or even suffocation don't seem to account for the evidence. There is, however, one more option that, upon close examination, could be our most likely candidate: shock. In medical science, shock refers to the effects of decreased blood perfusion and oxygen delivery to cells within the body. Traumatic hemorrhagic shock is caused by decreasing circulating blood volume, hypovolemia, as a result of injury and bleeding. That Jesus suffered traumatic hemorrhagic shock is suggested by the descriptions of his torture and execution. The heart beats faster and blood vessels in the body constrict, compensatory mechanisms by which the body seeks to maintain blood pressure and increase blood return to the heart. Extreme thirst can occur during shock as well. The human body can compensate for modest blood loss. However, shock can occur when blood loss surpasses 10%. At 45% blood volume loss, reduction in blood return to the heart and decreased resistance in the body's blood vessels will cause the blood pressure to drop to 0. There is a point beyond which blood pressure cannot fall without eventually causing death in spite of the best medical treatment. The effects of shock are many. Cardiac function can become impaired, blood vessels do not function properly, inadequate oxygen supply can cause cellular death, leading to widespread inflammation and toxic chemical effects. Acidity develops within the body. The effects of shock are many and each one serious, all the more when multiple effects occur simultaneously. Even more dangerous is the amplification of shock through a snowball effect called a positive feedback loop. That is to say, shock causes more shock. The body's first defense against bleeding is for blood to clot at the site of injury. A dangerous possible complication of shock is that blood can lose its normal ability to clot. This has become known as trauma-induced coagulopathy. It is present in 1 in 3 trauma patients admitted to emergency departments and carries a markedly increased risk of death. Trauma patients admitted to emergency departments are 4 times more likely to die if coagulopathy is present. Causative factors that trigger coagulopathy during trauma are tissue injury with bleeding, hypothermia, and acidemia. With diffuse injury and widespread activation, the blood clotting mechanisms, necessary blood cells, and chemical factors can be depleted and cause an imbalance between the blood's ability to clot and dissolve unnecessary clots. This is detrimental amplification of the body's natural process of dissolving unneeded blood clots just when the blood's ability to clot is needed most. That is to say, the body shifts to dissolving clots abnormally when it should be producing more clots where needed instead. Hypothermia, decreased core body temperature to 36 Celsius or below, impairs blood coagulation. In the human body, a decrease in blood temperature slows the activity of enzymes associated with blood clotting. Another inciting factor that contributes to coagulopathy is when the blood becomes acidic, called acidemia, decreased blood pH, which makes the blood more acidic. The process leading to this is called acidosis. Like decreased temperature, acidity in the blood slows the enzyme activity associated with clotting. Trauma-induced coagulopathy is an ominous potential complication of traumatic hemorrhagic shock and markedly increases the risk of death. The greater the tissue injury and bleeding, the greater the risk. Acidemia and hypothermia are also triggering factors and common during shock. When tissue injury with bleeding, acidemia, and hypothermia occur simultaneously, they create a positive feedback loop of progressively worsening coagulopathy. This has been called a lethal triad. Trauma-induced coagulopathy is difficult for physicians to treat in the best modern trauma centers. In Jesus' time, death would have been certain and rapid. Thirst from hemorrhagic shock is the result of decreased blood volume, hypovolemia. This stimulates thirst centers in the brain by 2 separate mechanisms. Pressure sensors in arteries, baroreceptors, react to decreased blood volume and trigger thirst centers in the brain. Decreased blood flow to the kidneys will activate the renin-angiotensin system, a hormone system that regulates body fluid and blood pressure, and also stimulate thirst centers in the brain. Literary references to thirst during crucifixion describe a maddening agony. When Jesus said, "I am thirsty," it was almost certainly as a scream. The environmental conditions were present for Jesus to develop hypothermia. Sympathetic nervous system activation caused him to be anxious, sweaty, have a rapid heart rate, and cause blood vessel constriction. He would have been cold and clammy. Jesus' clothes were taken from him at the crucifixion site, leaving him exposed to the ambient temperatures. Temperatures were cold in the early morning hours after Jesus' arrest. Peter followed the temple guard with Jesus to the palace of the high priest. He stayed some distance away but tried to monitor what was happening. Yet it was cold enough that Peter lost his hesitation and joined the temple guard to warm himself by a fire. Average temperatures in Jerusalem during the first week of April ranges from 8 to 20 degrees Celsius, 46 to 67 degrees Fahrenheit, but can drop as low as -1 degree Celsius, 30 degree Fahrenheit. It was cold the day that Jesus was crucified, hanging naked on the cross in cool ambient temperatures, sweaty, and with arms and legs cold due to blood vessel constriction from the effects of blood loss, make it likely that Jesus was hypothermic. The lethal triad of causative factors for trauma-induced coagulopathy were present, namely tissue injury with blood loss, acidemia, and hypothermia. Without objective medical data such as laboratory and hospital records, the mechanism of death cannot be known with absolute certainty, and may have differed among crucifixion victims. Suffocation as the mechanism of death with crucifixion is untenable, however. Spontaneous cardiac rupture as a cause of Jesus' death is implausible as well. Shock is the most plausible explanation for Jesus' death. Trauma-induced coagulopathy was a possible contributing factor and may have hastened his death. Forensic pathologist and medical examiner Frederick Zugibe agrees, stating that the cause of death was cardiac and respiratory arrest due to hypovolemic and traumatic shock due to crucifixion. The description of Jesus' execution written by ancient observers without medical education can be explained as consequences of traumatic hemorrhagic shock. From a medical perspective, the gospel accounts of Jesus' death appear genuine. In a somewhat macabre statement at the Last Supper, it's as if Jesus seemed to say that the mechanism of his death would be exsanguination. And he took a cup, and when he had given thanks, he gave it to them, saying, "Drink of it, all of you, for this is my blood of the covenant, which is poured out for many for the forgiveness of sins."